Well, I'm really happy that we recorded this, huh?
Yeah.
What probiotics do you usually recommend?
It's different for each person because some people need strep-reducing strains, some people need histamine strains, delactate-free strains, so it's not as simple always, but I just recommend starting with any of them that are more GMP certified, that are pharmaceutical grade. There was a study out of New York that showed that 12 out of 19 probiotics checked that you could buy over the counter actually had the colony-forming units in them that were listed on the label. So I like Claire Labs, Klaire. I like Orthomolecular. I like Gut Pro. I like Custom Probiotics. I like, gosh, there's so many different ones. I like some of the Prothera probiotics. I like Garden of Life Primal Defense Ultra, Microspora. The list goes on and on. Just Thrive. S. boulardii, phenomenal, well-researched strain. Lactobacillus GG can be helpful for some patients. So really, if you go to emersonecologics.com, any probiotic that they have is pretty good, and they list the gold label supplements and the silver label supplements. The gold label have the most rigid and careful independent third-party testing. Any gold label brand on Wellevate is where you can order as a patient is helpful, and you can get a 15% discount on that if you put the code in that's listed on our website, so you can get it cheaper than usually you can get it anywhere else.
What was that,
Emerson Ecologics and Doctor's Supplement Store. Those are two vendors, Doctor's Supplement Store and Emerson Ecologics. Emerson has just transitioned over to a program called Wellevate. And if you go to newbridgeclinic.com and go to the products page, you can put in a code and you'll get a discount on the supplements if that's a cheaper way for you to get them. Questions?
Mm-hmm. And that therapy being
Yeah. Yeah, you do have to be careful with hyperbarics. It's not for everybody. I would say half of the Lyme patients have an improvement with hyperbarics, but half do not, and some of them get worse. The herxing can be pretty tremendous, and for some co-infections, we don't recommend it. Yeah.
You talk about a lot of different tests to use to determine what's right for each individual. Do you do those tests? You can do those
Yeah, anything that I mentioned we can do. I have training in functional medicine as well as Western medicine, so we incorporate both sets of tests. And a lot of the functional medicine is actually covered pretty well by insurance. It's a lot better than it used to be in terms of getting covered. There's usually like a deposit or copay that you have to pay, but the rest of it is covered by insurance. Yeah. Yeah.
Do you recommend a specific lab for getting the Marchan's test?
Yeah, Richie Shoemaker recommends a test called Marchan's, which is basically looking for resistant bacteria in the sinuses. So if you've been exposed to mold and you have mold biotoxin illness, and oftentimes it's present in Lyme patients as well, that and especially if you have a history of any kind of sinus issues, but you don't have to have a history of sinus infections to have it be an issue. For people that just want to do it and don't have a practitioner, you can get it done through Labs for Life, who they'll coordinate for you to get it done. It does require a very uncomfortable nasal swab. You have to use a very thin wired swab that goes up your nose and down the back of your oropharynx and swab. So it's not something that a lot of people like to do. So some patients elect to just get treated rather than do the test because it's a painful, yucky test. But it is helpful to do. If you have it, the Marchan spray, which is a prescription compounded spray, can be really instrumental in people feeling better. I have some patients in my practice that, the nasal sprays with the antifungal and the antibacterials that get at some of these bacteria and fungus really tremendously improve their quality of life.
Is there a downside to just doing the spray?
Again, you're just doing some alterations to the microbiome in your sinuses. If you maybe don't have Marchan's and you just treat, you could be killing good bacteria that you don't want to treat. So sometimes for patients that are nervous about doing the test, we'll do a short trial of it. If they've got the right history, and if we're very suspicious of it, we might do a short trial and see if they see improvement. And if they do, then sometimes we'll just continue. If they're not seeing improvement, then we don't. Yeah.
Do you take health insurance?
We are out of network, but we do bill to health insurance. So most functional medicine integrative clinics, Lyme doctors don't take insurance, primarily for the reason of protecting ourselves from board of medicine, issues. So basically, there's kind of the standard of care in Western medicine, and many of us are practicing above and doing more progressive things to help patients, because patients can't always wait 20 years for the research to all come out on all of this. So we need to treat patients now with treatments that are going to be helpful for them. So we do submit to insurance, and if you've met your out-of-network deductibles, most of our patients that have met their out-of-network deductibles will get reimbursed with private insurance. We cannot submit to public insurance because they won't accept out-of-network claims. We would submit if we were able to, but they don't accept our claims.
Since we do have that moratorium with the medical board in Minnesota now for the next, 3 years at least?
Which is great. Thank you for your role in helping with that.
Is there a possibility that we could encourage clinics to try to get on board with getting in network with insurance? Because that would be so huge for us.
Yeah. I would say it might be helpful to have kind of a roundtable discussion with some of the Lyme doctors in town to just talk about the risks and benefits of doing that. My intent in starting Newbridge was for us to be in network. That was our plan. It was in our business plan. I came from children's and working with populations that were not able to afford care, and a lot of low income and high ethnicity groups that really couldn't afford care. And that's where my heart is. I want to help people that, which is why we do the groups and why we have the support groups and things like that. I want to help people. But we were advised by our attorneys and a plethora of other integrative clinics around the country that if you want to go out of business because of medical board disputes, and not just that, but insurance companies. Insurance companies, audit you and say you have to pay back X amount of dollars because you're, it's really the insurance companies at this point that are almost a bigger issue. And I know 2 doctors in Minnesota who used to be in network who have gone out of network because of that issue. And so I think it's a huge problem. And we'd like to be able to do that, but there's just a lot of barriers. Unfortunately, yeah. So, but we're really interested in trying new models of ways to make the care more affordable, because even when people do have in-network insurance, many times they have such high deductibles that it's still very expensive. So I used to have panels of tests that used to be totally covered by insurance, standard tests, that now are $4,000 for people because they have to meet a high deductible before their labs are covered. So all of insurance is really changing, and I think the current system is really broken. We need to develop new systems of providing health care that work for patients and that don't break the bank, but provide better care. And I do think group visits are maybe part of that solution.
So you mainly see children. So if we wanted to come to your clinic, who would you recommend for us to try to?
Yeah, so Kathy Moore is our physician's assistant, and she has family members with Lyme and is well versed in a lot of that because of kind of living through it and doing her own self-study. And she has also gone to lots of conferences and done training kind of on her own. She'll be going to ILADS this fall. And she would be great. She also is skilled in applied kinesiology, so the people that don't have good lab coverage and that want to do applied kinesiology testing to assess for infections and which treatments might be helpful. So that's muscle testing. She has that skill set, which can be really helpful. And we have correlated the muscle testing with lab testing and found that they really do correlate quite well. So, we're getting the same results on muscle testing that people got on their lab testing that we didn't even see before we did the muscle testing, So basically, I do feel that that's a viable option for people that need to save money on some of those expensive lab tests. And Dr. Dolan is our family practice physician, and she has been to ILADS undergrads and has mentored with myself and Leslie Valinsky and is knowledgeable about Lyme, and she tends to do more of the antibiotics between Kathy Moore and Kathy Dolan. Kathy Dolan does more antibiotics, and Kathy Moore tends to do more of the herbs and homeopathy and LDI and things like that. But often we'll do antibiotics as well. But just so you know the styles of different people. Yeah.
Leslie Valinsky, she's working with you?
Leslie worked for us for about 1.5 years, and she's decided to try to get her business closer to home. She was having a really long commute and is trying to build her practice in Savage. But we're still good friends and talk a lot. But Leslie was with us for about 1.5 years. Yeah, till 2 years maybe. Yeah.
Is there a difference in what an NP and a PA can treat with?
Not really. In Minnesota in 2015, nurse practitioners gained independent practice, so I don't need a physician to sign orders or anything. I can do everything the physicians can do outpatient. So it really doesn't limit. And as long as, for a PA, they do need a collaborating physician. And as long as Kathy Dolan is Kathy Moore's collaborating physician, as long as they are, basically they consult together and things like that, there's really no restriction. Yeah. Yeah. Any other questions? Yeah.
Does a person have to see you before they can come to group studies, or can you just sign up for group studies?
So the group question and answer sessions and support groups are open to anyone, and you don't have to be seen individually, and those are $15 to $20 for an 1.5 hours led by a knowledgeable practitioner. I lead a lot of those groups, but there are, certainly our other doctors lead some of them as well. For our clinic group sessions, which is where you can get prescriptions ordered, you can get labs ordered, it's more like a clinic visit, but just with a group of people. Those require a short visit, which can be 15 to 30 minutes, depending on what you have going on, to get an exam as a one-on-one visit, and that would be at the one-on-one rate. And then after that, you can join a group. So you do need one short one-on-one visit just to get your problems, what testing you've had done, and your exam. And then after that, you could meet. And the group visits are intended to be every other month, with the odd month going to support groups and question and answer groups. So it'd be a clinic visit every other month, but it's a fraction of the cost of a one-on-one visit.
Do you find that the people that start with the groups all of a sudden jump up and get into the one-on-one?
It depends on the patient. We do have some patients that have gone to one-on-one groups, one-on-one sessions, because their needs were slightly different than the needs of the group. But I would say the majority so far of our groups, they're staying together. And we go around and we address each person's problem. So it's not like you're getting the same treatment that everyone else is getting in the group. We have scribes there that are recording what's going on and typing everything. So they're typing what I say or what the other practitioner is saying about a particular person as we go around. That's all getting recorded, and your individual labs and your individual treatment plan is getting ordered. So it is as individual as we can make it, but we do try to group the people as homogeneously as possible. So basically, if we have a bunch of new Lyme patients, that's going to be much better than a group of some people that have had it for a long time, and some people that are brand new, and some people that have more knowledge and experience. Would be better to be grouped with another, with a group that has more knowledge and experience. So when you call in, if you're interested in a group, you need to just specify your level of experience and how long you've been sick, and if you kind of prefer more of the Western medicine route, or if you prefer more of an integrative route, and we try to group people based on that. So, all right. Well, thank you so much for coming, and lots of information, so I hope it didn't go over people's heads. So thanks so much.